Did you know that simply pressing a point on your hand or neck might help reduce your risk of stroke? I didn't believe it at first either. Not until I spoke with Dr. Hiroshi Tanaka, a senior physician in Tokyo with over 35 years of experience in both conventional medicine and traditional therapies. During our conversation, he told me something that stayed with me. He said, "In Japan, we don't just treat stroke after it happens. We teach our elders simple ways to keep the blood flowing to the brain every single day." Massage and acupressure are among the most important. Western medicine often waits for a problem, but Eastern medicine tries to prevent it. That struck me, because here in the United States, most people over 65 are given medication for high blood pressure, blood thinners, or cholesterol drugs. But very few are ever told that their own two hands could be used every day to support circulation, calm the nervous system, and keep arteries flexible. It's not about replacing your doctor or your prescriptions. It's about adding a small, natural practice that could make a big difference. And here's why this matters so much. By the time you finish watching this video, about 40 minutes, around 60 Americans will have suffered a stroke. 60 families will be changed forever. Some of those people will survive, but never walk or speak the same way again. Others may lose their independence completely. This is why prevention isn't optional. It's urgent. Now imagine instead starting your morning with a gentle massage at the base of your skull, or pressing the soft web between your thumb and index finger. Imagine that while you do this, blood flows more smoothly, blood pressure eases, your brain receives a steady supply of oxygen. You don't feel pain. You don't need equipment. You just spend 2 or 3 minutes and your body thanks you. Dr. Tanaka told me, it's like brushing your teeth. You don't wait until the cavity comes. You clean a little every day. Stroke prevention should be the same, and science is beginning to agree. Recent studies have shown that seniors practicing acupressure experience lower blood pressure, fewer dizzy spells, better balance, and even improved sleep quality. One study in the Journal of Geriatric Cardiology confirmed that massaging certain points helped reduce blood pressure in older adults with hypertension, a key risk factor for stroke. The beauty is that this practice isn't complicated. You don't need to memorize hundreds of points. You don't need an expert by your side every day. There are just a handful of key spots on your neck, your hands, your feet, that anyone can learn to find. And once you know them, they become part of your daily routine, like drinking water or taking a short walk. So in this video, I'm going to share with you the 10 most effective massage and acupressure techniques that Dr. Tanaka himself recommends to his older patients in Japan, translated here for you, seniors in America. You'll discover which points matter most, how to press them safely, and why they work, explained in both modern science and ancient wisdom. Because stroke is not something you prepare for when it happens. It's something you prepare against every single day. And sometimes, the smallest habit, like pressing with your thumb for 30 seconds, could be the quiet shield that protects your independence, your memory, and your future. So stay with me until the end. These 10 techniques might just be the simplest, most natural way to keep your brain and body strong for years to come. Let's begin with the very first technique, one that Dr. Hiroshi Tanaka from Japan often recommends to his older patients. He once told me about a 74-year-old retired teacher who came to him with constant dizziness, stiff neck muscles, and frequent headaches. Instead of simply adjusting her medication, he guided her to a special point at the base of her skull, called Fengqi, or the wind pool point. After just 2 weeks of practicing gentle pressure on this spot every day, her dizziness improved, her headaches eased, and she even reported sleeping more peacefully at night. So how do you find this point? Take your hands and place them at the back of your head. Slide your fingers down until you feel the hard edge of your skull. Then move them outward, about 2 to 3 finger widths from the center of your neck. You'll feel a small hollow, a little dip just beneath the bone. That's Feng Qi. You have one on each side, left and right. If you press lightly and it feels slightly tender, you've found the right spot. Here's how to perform the massage. Use your thumbs to press into both hollows at the same time. Apply firm but comfortable pressure. Not so much that it hurts, but enough to feel a gentle, dull ache. Hold the pressure for about 10 to 15 seconds. Then, keeping your thumbs in place, make slow, circular motions in a clockwise direction for about 1 minute. Release, take a deep breath, and repeat this 2 or 3 times. In total, it takes no more than 3 minutes, yet it can leave your head and neck feeling lighter and more relaxed. Why is this point so important? The Feng Qi point is located right where 2 major blood vessels, called the vertebral arteries, pass up into the brain. In many older adults, the neck muscles tighten and put pressure on these arteries, limiting blood flow to the brain. That reduced circulation can lead to dizziness, headaches, and even higher risk of stroke. By pressing and massaging this point, you help relax those tight muscles, improve blood flow, and stimulate nerves that activate your body's rest and repair response. This can gently lower blood pressure and give your brain a steadier supply of oxygen. Research supports this. Studies have shown that seniors who regularly stimulate Feng Qi experience fewer headaches, better balance, and calmer blood pressure readings. One study even confirmed that it improves cerebral blood flow, which is crucial for stroke prevention. A few tips can make this practice even more effective. Try doing it first thing in the morning to wake up your brain and again before bed to help you relax. Warm your hands by rubbing them together before you start. The heat adds comfort and relaxation. And while pressing the point, focus on slow, steady breathing. Inhale through your nose for 4 seconds, hold for 2, then exhale through your mouth for 6. This breathing rhythm enhances the calming effect of the massage. Of course, be careful. Gentle, consistent pressure works better than force. Avoid this massage if you've had a recent neck injury, surgery, or if pressing causes sharp pain. And if you're taking blood thinners, don't press so hard that you bruise. Always remember, this is not a replacement for your medications or medical care. It's a supportive daily habit you can add to your routine. That's why I chose Feng Qi as the very first technique to share with you. It's simple, safe, and powerful. Just a few minutes of gentle pressure each day can help your blood flow more freely and give your brain the support it needs. As Dr. Tanaka told me, when you press Feng Qi, you're not just touching a point, you're opening a gateway that keeps the brain alive and strong. The second technique, Dr. Tanaka shared with me, focuses not on the back of the head, but on the space between your eyebrows. This spot is known in Eastern medicine as yin tang, but many people simply call it the calm mind point. Dr. Tanaka told me about an older gentleman in his clinic who had suffered from restless nights, constant worry, and a heavy pressure in his head. Instead of giving him more sleeping pills, Dr. Tanaka showed him how to gently massage this simple point. Within days, the man noticed that his sleep was deeper, his headaches were lighter, and he felt less anxious during the day. So how do you find this point? It couldn't be simpler. Place one finger right between your eyebrows, just above the bridge of your nose. You'll feel a soft spot there. It's not bone, but a slightly tender area of skin and muscle. That's yin tang. Here's how to work with it. Use your index or middle finger to press gently into the spot. Keep the pressure light and steady, no harder than you would press on your eyelid. Hold the pressure for 20 to 30 seconds. Then begin to make small, slow circles with your finger, moving clockwise for about 1 minute. Release, take a deep breath, and repeat this 2 or 3 times. The entire practice takes less than 3 minutes, but the effects can be surprisingly powerful. Seniors often describe feeling calmer, less tense, and even noticing that their eyes feel more relaxed. Why does this point matter? The yin-tang point is closely connected to the nerves and tiny blood vessels around the forehead and eyes. When stimulated, it helps calm the nervous system and ease tension in the muscles of the face and head. For seniors, this can reduce anxiety, stabilize blood pressure, and improve blood flow to the brain, all of which play an important role in lowering stroke risk. Modern research is starting to confirm what Eastern medicine has taught for centuries. Studies have shown that massaging the yin-tang point can lower heart rate, reduce blood pressure, and improve sleep quality. In fact, hospitals in parts of Asia sometimes use this very point as part of relaxation therapy for patients with hypertension. Here are a few tips to make it even more effective. Try practicing this massage in the evening, especially if you often feel stressed before bedtime. Pair the massage with slow, steady breathing. Inhale deeply through the nose for 4 seconds, then exhale slowly through the mouth for 6. Some people also like to close their eyes while massaging, which enhances the calming effect. Of course, safety is important. Don't press too hard. This area is delicate, and gentle pressure is all that's needed. If you have sinus infections or eye problems, avoid pressing directly until those conditions are treated. And remember, like all acupressure techniques, this is meant to support your health, not replace your prescribed care. What I love most about yin-tang is its simplicity. It's just one point right between your eyebrows that anyone can find and use. But it carries an incredible power to calm the mind, ease tension, and bring balance to the body. And for older adults, that sense of calm is more than comfort. It's a shield against the stress and high blood pressure that so often lead to stroke. As Dr. Tanaka once told me, a calm mind is the foundation of a healthy brain. Yin-tang is the key to opening that calm every day. Now let's move to a point that almost everyone has instinctively touched at some point in their life, the temples. In Eastern medicine, this spot is called taiyang, but you probably just know it as the soft area at the sides of your forehead. Dr. Tanaka once explained that when his patients came in complaining of pounding headaches or sudden spikes in blood pressure, he often showed them how to gently massage their temples. One of his patients, an older woman in her 70s, admitted that every afternoon she felt pressure building in her head, almost like a storm about to break. After learning the taiyang massage, she discovered that just a few minutes of gentle circular movements at her temples could quiet the storm and help her blood pressure stabilize. Here's how to find it. Place your fingers on the sides of your head, just above the cheekbone, in line with the outer corners of your eyes. If you gently press, you'll feel a slight hollow. That's the taiyang point. Most people notice that it feels a little tender, especially if they are stressed or tired. Now, here's how to use it. Place your index or middle fingers on each temple. Apply light pressure, enough to feel it, but never to cause pain. Hold for about 15 seconds. Then begin making small, slow circles in a clockwise direction for 1 minute. After that, pause, take a deep breath, and repeat the process 2 or 3 times. Altogether, it takes just 3 to 5 minutes. Why does this work? The temple region has many tiny blood vessels and nerves that influence circulation to the head and brain. When you massage taiyang, you help dilate those small vessels, release muscle tension, and improve blood flow. For seniors, this can ease headaches, reduce eye strain, and lower stress levels, all of which support healthier brain function and reduce stroke risk. Scientific studies support this effect. Research has shown that temple massage can lower systolic blood pressure in older adults and significantly reduce the intensity of tension headaches. It's not magic, it's physiology. Relaxed muscles and improved blood flow mean less strain on the arteries that feed the brain. Here are a few tips to make the practice more effective. Try doing this massage during the day, especially if you feel a headache starting or if your eyes feel heavy after reading or watching TV. For added relaxation, close your eyes while massaging and focus on slow breathing. Some people also like to add a drop of lavender oil or a warm compress over the temples to enhance the soothing effect. Of course, keep it safe. Don't press too hard. This is a sensitive area. Avoid the massage if you've had recent eye surgery, severe migraines, or any condition where pressure around the eyes is not recommended. And remember, this is not a replacement for blood pressure medication or medical treatment, but a gentle tool you can use every day. The beauty of Taiyang is that it's already familiar. We've all rubbed our temples when stressed or tired, but now you know why it helps. With just a few minutes of mindful massage, you can support your circulation, relax your nervous system, and give your brain a much-needed break. As Dr. Tanaka said, your temples are not just where you feel stress. They are a doorway to release it. Now let's move to one of the most famous and widely used acupressure points in the world. It's called Higu, or the Union Valley Point. You'll find it right on your hand, in the fleshy area between your thumb and index finger. Dr. Tanaka told me that whenever his patients complained of sudden headaches, facial tension, or spikes in blood pressure, this was the first point he taught them. One of his patients, an older man who used to work as a fisherman, suffered from constant tension headaches and mild hypertension. He started pressing this point every morning and evening, and within weeks, he noticed not only fewer headaches, but also more stable blood pressure readings. So how do you find it? Hold out your hand with your palm facing down. Look at the space between your thumb and index finger. As you bring the thumb and finger together, you'll see the muscle bulge up, forming a small mound. Now relax your hand, and in the middle of that fleshy web is the Heg point. When you press it, you may feel a mild ache or tenderness. That's how you know you're in the right spot. Here's how to use it. With your other hand, place the thumb on top of the point and the index finger underneath the hand for support. Press firmly, but not painfully. Hold the pressure for about 20 to 30 seconds. Then, begin making small circular motions with your thumb for 1 minute. Switch to the other hand and repeat. Do this 2 or 3 times on each hand. In total, it takes just 5 minutes. Why does this work? The Hegu point is connected to nerves that influence blood flow in the head and face. Stimulating this area helps relax tension in the blood vessels and muscles, which can ease headaches, reduce stress, and support healthy circulation. For seniors, this is especially important because high blood pressure and stress are 2 of the most common risk factors for stroke. Research has confirmed these effects. A study in complementary therapies in medicine found that pressing the Heg point significantly reduced systolic blood pressure in adults with hypertension. Other studies have shown it helps decrease the frequency of tension headaches and promotes overall relaxation. Here are some helpful tips. You can practice this technique almost anywhere, while watching TV, sitting in a chair, or even before going to bed. Many people find it especially helpful during stressful moments. If you feel anxious, restless, or notice your blood pressure creeping higher, take a few minutes to press this point. Combine it with slow, deep breathing for the best results. Now, a word of caution. Don't press too hard, especially if you're on blood thinners, since it could cause bruising. And this point should not be used by pregnant women because it has been shown to stimulate uterine contractions. For seniors, though, it's generally safe when done with gentle, consistent pressure. The beauty of Heg is its simplicity. It's right there on your hand, easy to find, easy to use, and it only takes a few minutes, yet it has the power to calm the mind, ease pain, and support healthier blood flow to the brain. As Dr. Tanaka reminded me, when life feels heavy on your head, press Hegu. It lightens the pressure and clears the path for your brain. The 5th technique takes us from the head and hand to the wrist. This point is called Niguan, or the inner gate point. It's located on the inside of your forearm, just a couple of inches above your wrist crease. Dr. Tanaka often calls this the heart-calming point. He once described an older patient who would wake up at night with her heart racing, feeling anxious for no clear reason. Instead of increasing her medication, he taught her to gently massage Neiguan before bed. After a few weeks, she reported that her heart no longer pounded at night, her sleep improved, and she felt less anxious during the day. Here's how to find it. Hold out your arm with the palm facing up. Look at the crease where your wrist bends. From that crease, measure about 2 to 3 finger widths up your forearm. In the middle, between the two tendons you can feel running along your arm, is the Neiguan point. If you press gently, you'll notice a sensitive or slightly sore spot. That's it. Now let's talk about how to use it. With the thumb of your opposite hand, press down gently but firmly into the Neiguan point. Hold the pressure for about 20 to 30 seconds. Then make slow, circular motions with your thumb for 1 minute. Switch to the other wrist and repeat. Do this 2 or 3 times on each arm. The entire routine takes just 5 minutes, but it can create a noticeable sense of calm. Why does this point matter? The Neiguan point is closely connected to nerves that regulate the heart and the digestive system. By stimulating it, you activate the parasympathetic nervous system, the part of your body responsible for rest and relaxation. For seniors, this can mean steadier heart rhythms, lower anxiety, and even improved blood pressure control. Scientific research supports these benefits. A study in the American Journal of Chinese Medicine found that stimulating Neiguan reduced both blood pressure and heart rate in patients with hypertension. Other studies show it can relieve nausea, calm anxiety, and improve sleep, all important for protecting brain and heart health and reducing stroke risk. Here are some tips to get the most out of this technique. Try practicing Neiguan massage in the evening, especially if you tend to feel restless, or if your blood pressure rises at night. You can also use it during stressful situations, before a doctor's appointment, for example, or when you feel nervous. To deepen the effect, close your eyes and breathe slowly. Inhale through your nose for 4 seconds, hold for 2, then exhale through your mouth for 6. A few cautions. Don't press too hard. Gentle, steady pressure works best. If you have recent wrist injuries, arthritis, or severe pain in this area, avoid pressing until it's healed. And as always, remember, this is not a replacement for your heart medications or medical care. It's an extra tool you can add to your daily routine. The beauty of Neiguan is that it gives you a sense of control. It's simple, safe, and always within reach. Just a few minutes of massage can calm your heart, steady your nerves, and help your circulation flow more smoothly. As Dr. Tanaka once said, "When the heart is calm, the brain is safe." Neiguan is the gate that opens that calm. Now let's move from the upper body all the way down to the feet. This next point is called Yangquan, which means the bubbling spring point. It's located on the sole of your foot and is one of the most grounding points in all of acupressure. Dr. Tanaka told me about an elderly farmer he once treated in rural Japan. The man had high blood pressure, trouble sleeping, and constant fatigue in his legs. Dr. Tanaka showed him the Yangquan point and encouraged him to massage it every night before bed. After just a month, the man reported that his sleep was deeper, his legs felt lighter, and his blood pressure readings were more stable. Here's how to find it. Sit in a comfortable chair and bring one foot onto your opposite knee so you can reach the sole. Look at the bottom of your foot. Imagine dividing the sole into thirds from heel to toe. In the front 1/3 section, just behind the ball of your foot, you'll notice a small hollow in the center. That's Yangquan. It's often slightly tender when pressed. That's how you know you've found the right spot. Now here's how to use it. With your thumb, press into the hollow and hold the pressure for about 20 to 30 seconds. Then begin making slow, circular motions for 1 to 2 minutes. Release, take a deep breath, and repeat 2 or 3 times. Switch to the other foot and do the same. The whole process takes no more than 10 minutes, and it can be deeply relaxing. Why does this matter? The Yongquan point is considered the starting point of one of the body's major energy channels in Eastern medicine. In practical terms, pressing this point helps relax the nervous system, improve circulation in the lower body, and gently lower blood pressure. For seniors, it's especially important because poor circulation in the legs can increase stroke risk and contribute to falls. Stimulating this point helps bring energy and blood flow back upward toward the brain and heart. Science supports this. Research published in the Journal of Alternative and Complementary Medicine found that foot reflexology, which includes massaging the Yongquan point, significantly lowered blood pressure in older adults with hypertension. Other studies show improvements in sleep quality and reduced feelings of anxiety when this point is regularly stimulated. Here are some tips to make it even better. Try massaging Yongquan before bed to calm the mind and prepare for restful sleep. For added benefit, soak your feet in warm water first, or use a warm towel to soften the muscles. This makes the massage more comfortable and effective. Some seniors also find it helpful to add a drop of lavender oil or peppermint oil to enhance relaxation. And a few cautions. Don't press too hard, especially if you have sensitive feet, neuropathy, or circulation problems from diabetes. If you notice sharp pain or bruising, stop immediately. And remember, while this practice can support your health, it should never replace your medications or doctor's care. The beauty of Yongquan is its simplicity and grounding effect. Just a few minutes of pressing this point each evening can calm your nervous system, improve circulation, and support your brain and heart. As Dr. Tanaka said, the feet are your foundation. When you press Yongquan, you send strength from the ground up, protecting both the heart and the brain. This next point is located on the lower leg, just above the inner ankle. It's called Sanyin Jiao, which translates as the 3-yin intersection point. It's one of the most important acupressure points for overall circulation and balance. Dr. Tanaka told me about an older woman in her late 60s who often complained of swelling in her ankles, heavy legs, and trouble with balance. He showed her how to massage Sanyin Jiao every morning and evening. After several weeks, she reported less swelling, more energy in her legs, and even a steadier gait when she walked. Here's how you can find this point. Sit comfortably and rest one leg across your opposite knee. On the inside of your leg, place 4 fingers just above the highest point of your ankle bone. Where your index finger lands, you'll find the Sanyin Jiao point. It's a tender spot along the inner shin bone. If you feel a slight soreness when pressing, you've found it. Now, here's how to use it. With your thumb, press into the spot gently but firmly. Hold for about 20 to 30 seconds, then make slow, circular motions for 1 to 2 minutes. Switch to the other leg and repeat. Do this 2 or 3 times on each leg. The whole practice will take you around 10 minutes. Why is this point so valuable? Sanyin Jiao is closely connected to circulation in the lower body. By stimulating it, you help reduce swelling, improve blood flow back toward the heart, and support better balance. For seniors, this is especially important because weak circulation in the legs doesn't just increase stroke risk, it also contributes to falls and mobility problems. Scientific research supports its benefits. Studies have shown that stimulating Sanyin Jiao can lower blood pressure, reduce leg swelling caused by poor circulation, and even improve sleep quality. Some clinical trials have also found positive effects on blood sugar and cardiovascular health, all of which are linked to stroke prevention. Here are some tips to make the massage more effective. Try practicing this in the evening, especially if your legs tend to swell during the day. Combine it with a gentle foot or calf massage to boost circulation. For added comfort, warm your hands before pressing or apply a warm towel to the leg first. And as always, Breathe slowly while massaging, inhaling through the nose, exhaling through the mouth. And a few cautions. Avoid this point if you have varicose veins, severe leg pain, or a recent leg injury. Gentle pressure is key. Don't press hard enough to cause bruising. And because this point is strongly connected to circulation, pregnant women should avoid it altogether. For seniors, though, it's a safe and supportive daily habit when done properly. The beauty of Sanyin Jiao is that it supports both the legs and the brain. By improving blood flow from the ground up, it lightens the burden on the heart and keeps oxygen moving steadily to the brain. As Dr. Tanaka put it, healthy legs mean a healthy brain. When you open Sanyin Jiao, you keep the river of life flowing smoothly. Now let's shift our focus to the chest. This point is called Danzhong, often referred to as the chest center point. It lies right in the middle of your chest and is closely linked to heart and lung function. Dr. Tanaka once shared a story about an older man in his early 70s who frequently complained of chest tightness and shortness of breath when walking. His doctors had already put him on medication for high blood pressure and cholesterol, but he still felt uneasy most days. Dr. Tanaka taught him to gently press and massage the Danzhong point for a few minutes each morning and evening. Over time, the man noticed less tightness, calmer breathing, and even steadier blood pressure. Here's how you can find it. Sit comfortably and place your hand on your chest. Imagine a line connecting both nipples. The midpoint of that line, right in the center of your sternum, is the Danzhong point. It may feel slightly tender to the touch, which is a sign you found the right spot. Now, here's how to use it. Place 2 or 3 fingers on the point and press gently but firmly. Hold the pressure for 20 to 30 seconds. Then, with the same fingers, make small, slow circular motions for 1 to 2 minutes. Take a deep breath as you massage, allowing your chest to expand fully. Repeat this process 2 or 3 times. Why is this point so valuable? The Danzhong point sits directly over the sternum, near nerves and vessels that regulate both the heart and lungs. Stimulating it helps release tension in the chest muscles, improve circulation in the upper body, and calm the nervous system. For seniors, this can reduce the feeling of heaviness or tightness in the chest and support healthier heart function, lowering stroke risk in the long run. Modern research supports its benefits. Clinical studies in cardiovascular therapy have found that stimulating points on the chest, including Danzhong, can reduce blood pressure, ease palpitations, and improve breathing capacity. This is particularly useful for seniors with hypertension or mild heart conditions. Here are a few tips. Massage this point in the morning when you wake up and again in the evening before sleep. Doing it in combination with deep breathing makes it even more effective. Inhale deeply through your nose, letting your chest rise fully, then exhale slowly through your mouth. Some people also find it helpful to pair this massage with gentle stretching of the shoulders and arms, which further opens circulation in the chest area. And a few cautions. Never press too hard. This is a sensitive area directly over your heart and lungs. If you experience sharp chest pain or known heart disease symptoms, stop immediately and seek medical attention. This practice is meant to support circulation and relaxation, not to treat medical emergencies. The beauty of Danzhong is how simple yet powerful it is. Just a few minutes of pressing this point can ease tension, calm your breathing, and support healthier circulation. As Dr. Tanaka reminded me, when the chest is open, the heart can beat freely and the brain can stay strong. This next point is one that many seniors find especially valuable because it helps with something nearly everyone struggles with as they age: sleep. It's called Anmian, which means the peaceful sleep point. It's located just behind the ear, in a small hollow that's easy to find with your fingers. Dr. Tanaka once told me about an older woman who came to him after months of restless nights. She could fall asleep, but she woke up several times, her mind racing, her heart beating faster than normal. She was afraid this lack of rest was putting extra strain on her health. Instead of giving her another pill, doctor, Tanaka taught her to press the Anmian point each night before bed. Within weeks, her sleep became deeper, her anxiety lessened, and she felt more refreshed in the morning. Here's how you can find it. Place your hand on the side of your head. Feel for the bone just behind your ear, called the mastoid bone. Now slide your finger slightly back and up into a small hollow just behind that bone. That's the Anmian point. You have one on each side, so you can massage them together or one at a time. Here's how to use it. Lie down or sit comfortably. Place your fingers on the hollows behind each ear. Apply gentle but steady pressure for 20 to 30 seconds. Then begin making slow, circular motions for 1 to 2 minutes. Breathe deeply as you do this, inhaling through your nose and exhaling slowly through your mouth. Repeat the process 2 or 3 times before going to sleep. Why does this point matter? The Anmian point is connected to nerves that influence both sleep and relaxation. Stimulating it helps calm the mind, ease anxiety, and relax the nervous system. For seniors, better sleep doesn't just mean feeling rested. It also lowers blood pressure, reduces nighttime spikes in heart rate, and decreases the risk of stroke. Research backs this up. Studies in sleep medicine have shown that stimulating points around the ear, including Anmian, can improve sleep quality and reduce insomnia symptoms in older adults. Other research shows positive effects on lowering nighttime blood pressure and calming the heart rate. Here are some tips. Use this massage every evening, ideally right before you go to bed. Pair it with a quiet routine. Dim the lights, avoid screens, and focus on deep breathing. Some seniors like to add a warm compress behind the neck or listen to calming music while massaging this point. All of these combine to create a stronger relaxation effect. And a few cautions. Press gently. This area is close to sensitive nerves. Avoid the massage if you have ear infections, severe dizziness, or sharp pain. And remember, if you suffer from chronic insomnia or heart rhythm problems, always consult your doctor in addition to practicing this technique. The beauty of Anmian is that it gives you back one of the most precious gifts of all, peaceful sleep. Just a few minutes of gentle pressure can calm the mind, relax the body, and protect the heart and brain through better rest. As Dr. Tanaka told me, the brain repairs itself during sleep. By opening Anmian, you give the brain the quiet night it needs to stay strong. Our final technique takes us right to the very top of the head. This point is called Bai Hui, which means 100 meetings point. In Eastern medicine, it's considered one of the most important acupressure spots because so many energy pathways meet here. But even if you don't believe in energy channels, the location itself is powerful. It directly influences blood flow and nerve activity in the brain. Dr. Tanaka told me about an older patient who constantly felt foggy, unsteady, and drained of energy. She was afraid these were the first signs of dementia or another serious condition. Instead of frightening her, Dr. Tanaka taught her to gently massage Bai Hui every morning. Within a month, she reported clearer thinking, steadier balance, and even a lighter mood. Here's how you can find it. Place your fingers on the very top of your head. Imagine drawing a line up from the tips of both ears. Where those two lines meet, right at the crown of your head, is Bai Hui. If you press gently, you may notice a tender spot. That's it. Here's how to use it. Place your index and middle fingers on the crown point. Press down gently but firmly for 20 to 30 seconds. Then make small, slow circles for 1 to 2 minutes. As you massage, breathe deeply, focusing on the feeling of relaxation spreading through your head. Repeat this process 2 or 3 times. The entire practice takes just 5 minutes, yet it can leave you feeling more alert and centered. Why does this point matter? Baihui is located at the very top of the skull, near blood vessels and nerves that supply the brain. Stimulating it helps improve circulation, clear mental fog, and stabilize mood. For seniors, this means sharper memory, better balance, and reduced risk factors tied to poor brain circulation. Scientific studies support these effects. Research has shown that stimulating Baihui can improve blood flow to the brain, reduce symptoms of dizziness, and even ease mild depression in older adults. It's also been linked to lowering stress and balancing blood pressure, two key factors in stroke prevention. Here are some tips to make the most of it. Try this massage in the morning to clear your head and start your day with focus. You can also practice it in the afternoon if you feel mentally tired or unfocused. Some people like to combine Baihui massage with light scalp tapping using the fingertips, which further stimulates circulation. And a few cautions. Press gently. Too much force on the top of the head can cause discomfort. Avoid this technique if you have had recent head injuries, surgery, or severe headaches that don't have a clear cause. Always use this as a supportive practice, not as a replacement for medical care. What I love most about Baihui is its simplicity. It's right at the crown of your head, easy to find and deeply calming. Just a few minutes each day can give you a clearer mind, a steadier body, and a stronger sense of balance. As Dr. Tanaka said, "The crown of the head is the crown of life." Press Baihui each day, and you help keep the brain bright, balanced, and alive. We've now walked through 10 simple yet powerful massage and acupressure techniques. None of them require special equipment, and you don't need to be an expert to use them. All you need are your own hands, a few quiet minutes each day, and the willingness to make these practices part of your routine. Think about what we've covered. Pressing the base of your skull to relax blood flow into the brain. Massaging the point between your eyebrows to calm the mind. Rubbing the temples to ease pressure. Working on the hands, wrists, feet, legs, chest, behind the ears, and even the crown of the head. Each point may seem small, but together they form a daily ritual that helps keep your blood moving, your nerves calmer, and your brain more protected. Remember, these techniques are not meant to replace your medications or your doctor's care, but they can support what you're already doing, adding another layer of protection against stroke, one of the biggest threats seniors face. The beauty of this practice is consistency. Just like brushing your teeth or taking a short walk, these massages work best when you do them regularly. A few minutes in the morning, a few minutes at night, that's all it takes. Over time, the small effort adds up to big benefits: better circulation, calmer sleep, steadier balance, and more peace of mind. So here's my encouragement to you. Don't wait until it's too late. Start today. Pick 2 or 3 of the points we discussed and try them out tonight before bed. Tomorrow, add another one in the morning. Slowly, you'll build a simple routine that becomes as natural as sipping your morning coffee. As Dr. Tanaka once said to me, stroke prevention doesn't begin in the hospital. It begins in the quiet moments at home, with the care you give your own body each day. Your health is in your hands, literally. Use these techniques to support your brain, protect your independence, and give yourself the chance to enjoy more years of clarity and strength.